It's Dr. Anderson with North Texas Plastic Surgery, and today I'm going to talk to you about recovering from surgery after massive weight loss. In this, we're going to kind of blanket statement say surgery after massive weight loss. That may mean some sort of breast lift, some sort of body lift, tummy tuck, maybe an arm lift, maybe a thigh lift, any of those things. We're gonna give generalities here. I'll have other content that you can watch if we want more specifics, but we're going to talk about physical activity, emotional recovery after surgery, after you've lost a bunch of weight. Most likely, after your surgery, you're gonna stay overnight with us at the surgery center. So you'll go home the following morning. In that case, what's gonna happen, let's say your surgery was on Tuesday. You go home on Wednesday. What I tell folks, so you're going to have then a follow-up appointment with my nurse on Thursday. And so I'm telling you, as I'm seeing you the following morning before you go home, if I'm going to assess everything, make sure it all looks right, of course, blah, all that stuff. If you have any issues that day, send Clara a message. We are on Clara like a hawk to make sure that we're answering all your questions, because we're very attuned to this is our normal everyday stuff, but just having surgery and what to expect afterwards is not normal for you, so we're there to help guide you through it. So that's the day you go home, and then you have a follow-up with my nurse the following day to just make sure everything's looking all right, that if you have any drains, the output of those looks appropriate, that incisions are looking like they're supposed to. Just blanket go over everything to make sure that you're recovering and recuperating in a way that's going to optimize your results. There's a great variability in that immediate post-op period for how people feel, and quite frankly, all of it's normal. So some people have a really increased pain tolerance, and so they're saying to themselves, I was expecting something, but this is, I feel really tight, but it's not that bad. Some people are, higher up on the pain scale, and that's okay. Everybody's different. And because you've maybe had surgery in the past and you had surgery now, you can't totally expect in your head that, after your C-section you felt this way versus now that we did some form of a tummy tuck or body lift, you're gonna feel the same. It's most likely gonna be different, and that's okay. And like I mentioned, if there's concerns, you just send that Clara message and we talk to you and figure out and make sure that everything that you're going through is an expected route that people can take. Another thing that's very important in these early stages is hydration. So right after surgery, a lot of people don't have much of an appetite or any drive to really be drinking much in the order of fluids, but it's really important to do that to avoid getting behind. So we really want to push fluids and trying to take some amount of calories. One easy way to knock both of those out at the same time is protein shakes. What's most common there is like the 30-gram protein shakes that come in that little cardboard box that are at everywhere. So those can be an easy way to help with fluid intake and appropriate nutritional supplementation right after surgery. Another common thing that people don't know what to expect is dealing with drain tubes. So I will admit, drain tubes are miserable. People don't love them, but they serve a purpose, and the likelihood of having a complication like a seroma if I don't leave drain tubes, specifically for tummy areas, is prohibitively high. If we're doing arms or legs, almost certainly not going to leave one there. So the drain tubes, they don't feel good. It's pulling fluid out from the inside of your body, so most people are not used to that, and they're like, this is kind of weird. Although most of y'all that are coming to see me are moms, so you're like, fluids coming out of bodies is not that abnormal. But the thing that people talk about most, or I get questions about most, that I would love to clear up so that you don't have to be nervous, is it's very common, if not expected, for some leakage to happen alongside the drain tube where it's going into your skin, as opposed to through the tubing there. So a couple of things to address with that. If that's happening, first of all, very, very normal, and it's even more common in the very first few days after surgery. So easiest thing to do is take some cotton gauze or a maxi pad and just put it over that drain site so it can catch those drips that come out. The other thing to be aware of is if you're not stripping your drains, and you'll learn about what that means actually in your overnight stay, and my nurse will teach you about that. If you're not stripping your drains and they get a little bit of a clog in them and the fluid can't flow through the drain, it's gonna try and find a way out and go alongside the tube. So we can just put some gauze or a pad there to catch the drips, but we're also gonna kind of try and milk anything through the drain that will allow it to get them to function optimally. So hopefully we can avoid as much of that as possible, because it's not gonna hurt anything, but it's annoying. If you don't have gauze or cotton in there, you may get your garment wet, and then obviously we're adults, we don't like to be in wet clothes. I don't think kids like that either. Just knowing that that's something that can happen can be kind of, I guess, soothing in a way that nothing bad is going on. Now, specifically about pain. So like I mentioned, some people right after surgery, they're just like, this is easier than I thought. Sometimes that is my fault, because we're gonna do a nerve block in surgery. That nerve block for some people is more effective than others, just because pain is so subjective. So if we're doing my standard nerve block, that's gonna last hopefully somewhere between 12 and 18 hours. If you opt for Exparel, which is probably a foreign word, but eventually you will hear it, that block will last somewhere 48 to 72 hours. So what I think is really important is, even if you're feeling really quite good and relaxed, I still want you to have a baseline pain pill regimen that you're taking. So as those blocks wear off, you have some of that pain medication built up in your system, so that it can be an easy transition from nerve block wearing off to oral pain control. If we don't have some of those pain pills in our system and the block wears off, it tends to feel like it wears off very quickly and that you got hit like a bus. Obviously, I would like you to not feel like that. So again, early on, I say just set a timer, take the pain pills, even if you feel like you don't necessarily totally need it. So that way, as things are shifting from one phase to the other, your pain control can be optimized. As we transition out of the first day to 2 days after surgery and into the first week, there are other considerations that we need to take into account. Mobility is going to start getting easier, but we still need to be really careful. I want you up and walking, ideally when you're awake, hourly. And what that's gonna do is move your muscles, especially the muscles in the legs, and help blood flow well to do things that our body naturally does to prevent blood clots. There's multiple factors we're gonna do that help you prevent blood clots, but they can still happen. So even though we're gonna be wearing compression garments, we're gonna be taking a blood thinner shot for the first 8 days, you still need to be proactive in your own care, that you can do additional things so that we're really optimizing the likelihood of not developing a blood clot. And the easiest is walking while you're awake. I don't want you to get up every hour while you're resting to do that, because then you get no rest and be miserable, or even more miserable than it already is. We're also going to notice, as the first few days after surgery progress, that you're going to feel like you get more and more swollen. And you're going to feel that way because that's actually what's happening. So after surgery, I'm going to have you in a post-operative compression garment that I recommend wearing for at least the first 3 weeks. And we're gonna tell you that we want you to wear that around the clock. Obviously you can take it off to shower or bathe and launder the thing. Now, some people wanna get a second garment so they don't have to go through that entire process exactly in line. And if you wanna do that, that's fine. We'll take care of that for you. But that's going to help limit the amount of swelling that your body takes on. It's going to swell for sure, and it's going to take the swelling longer to go down than any of us want, because we want our final results like yesterday. But we're gonna do things early on to limit that swelling. Compression garments, number one. Now, I'm getting ahead of myself, but people always ask, when can I switch to a different type of compression garment? And that's gonna be generally at the 3-week mark, but we're gonna be seeing each other so we can talk about that as time goes on. People also want to really optimize how good their scars do. So right after surgery, you're going to have skin glue on, assuming you don't have skin glue allergy, but if you do, we'll do something else. And that generally will take 3 to 4 weeks to work its way off. As the skin glue comes off, we will recommend a scar cream that you can do. People also sometimes want to use scar tapes. Either is fine. I'm totally happy with that. I think the best one you can use is the one that you're actually going to use. So if you don't like the way the cream feels and the tape is easier for you, use the tape. If something else is vice versa, use the cream. But I think if we're doing something to proactively care for it, the likelihood that we end up with a scar that we're happy with is higher. Additionally, for scars, we want to keep them out of the sun as much as possible. And I'm going to tell you, at least for the first 6 months, it's ideal to not really have sun exposure. So if we're doing some sort of tummy area surgery and we have a little scar that goes around the belly button, and you are going to the pool and you want to wear something that shows off the belly button, we're going to be very careful to put some pretty intense sunscreen on that. And the reason for that is if we get a bunch of sun exposure early, it tends to do one of two things with scars. It will either make a scar that's going to be fading nicely and turn it pink for forever, or bright white for forever. And obviously we would like it to fade into the rest of your skin tone, so it's as discreet as possible. As we transition out of the first week and we're heading into weeks kind of 2 through 6, things are going to start getting easier. Hopefully they will. We here are going to tell you kind of the first week 0 through 3 is kind of in my head like phase 1, and then 3 through 6 is phase 2. So as far as activity level goes, I don't want you doing much of anything in the first 3 weeks that's really going to raise your heart rate above the level of 100 or so. Reason for that at its simplest is then we start to sweat. You can get garments rubbing on incisions and can increase likelihood of infections or incisions trying to pop open. And obviously if we can do things to decrease the likelihood of an infection or it wanting to open up, resulting in scarring that's less than ideal, we're going to do those. As we transition into weeks 3 through 6, I'm going to tell you can do stuff that we call light cardio. So for me, that's a brisk walk on a treadmill. If you have a stationary bike or Peloton, although I don't know if people really do Peloton anymore, that, but like not necessarily a class, but just kind of pedaling so you feel like you're moving. Those things are going to be fine. And then as we get to the 6-week mark, all activity and lifting restrictions will be taken away. In those same time frames, as far as compression garments go, again, weeks 0 through 3 get special treatment, and then weeks 3 through 6 get a different treatment. You'll be in the garment I provide you with in those first 3 weeks, and then we'll talk about what we call stage 2 in weeks 3 through 6. So most generally for those, we have links that we can send you of garments that patients have found in the past that they've been successful with. Sometimes you need to buy a couple just because sizing can be funky, and then plan on sending back the ones that don't fit as well or as snug as we would like. Additionally, as we're progressing and swelling is going down, you may actually find that you're needing to size down in garments, which maybe it's annoying to get another garment, but it's also very exciting that your swelling is going down enough that you justify getting something smaller because it's cool to feel like things are getting tight. When we see each other at your 6-week appointment, patients will often say, like, is this it? What? Doesn't look that good. But you're not done. Swelling is still going on. We're gonna say, I'm gonna tell you like 6 months to a year. Realistically, if we look at your 6-month photos and then we look at your year photos, the year photos are always gonna look better. Probably 90+% of swelling is gonna be down at 6 months. But that's just, everybody's so different. And especially in my super successful weight loss folks, because that skin has been through a little bit more life, it can take it a little bit longer to shrink back up. The most common thing I'm gonna see there where patients are a little, let's say, nervous is if we did tummy work, the vertical is nice and tight, but you'll get a little bit of laxity on either side of the vertical. That's gonna take at least a year to totally shrink back. And what I found is people will come in like at the 3-month mark and they'll bend over at the waist and they'll say, this is loose. And I'm like, I know, it's gonna get better. Give it time, it'll get better, and we'll keep watching it. And like, I'm not ignoring you, but I just know we need to give it time. And the vast majority of folks, when we get out to the year, they're like, oh yeah, I forgot that annoyed me. So just, this requires a lot of patience, as frustrating as that is. We're gonna transition from physical into mental. Something I've learned over time with patients who get surgeries like this is they are driven, active folks. And so people don't so much online, I've come to learn, acknowledge the mental and emotional aspects of this recovery. What's really honestly very common, when I see you at your 3-week mark, a lot of people are just like, they got the blues. And I think what really happens there is we go on this journey together. We take a person who is super busy, really driven, always doing stuff, and I kind of made you just sit in the house for 3 weeks. And our mind starts racing and going crazy, and just like thoughts seep in, and it's harder to kick them away. So the 3-week mark for a lot of folks tends to be the lowest dip on that spectrum. And then some of your restrictions are lifted, you start being more active, you start feeling better, you start feeling more normal. And then by the time I see you at the 6-week mark, when you're getting ready to be back into all your normal activities, your normal exercise routine, you've been back at work, you're not so tired at work, things have, like the skies have parted, the sun is shining, and things are just easier. But I don't want to ignore that it can be mentally and emotionally actually pretty tough, especially in that 3-week area. Now, it could be the 2-week area, it could be the 4-week area. All of that is, I see it commonly, but 3 weeks tends to be the bottom. So I always tell people, stick with it. When I see you at 3 weeks again, things will 100% for sure be better, but we just gotta, tough out the hard times, and I'll help you get through that. As we're transitioning out of the early period into long-term, I touched on this a little bit already. People like to ask, when can I expect final results? So 6 months is a really great time to say kind of this is what we can expect. But like I mentioned earlier, 1 year is going to be even better than that. In specifically folks that have lost a lot of weight, it takes the skin, it takes the tissue longer to shrink up and recoil and do all the things that we want it to than, somebody who hasn't been through that aspect of life. And that's okay. I'm going to try to help guide you through this to have expectations in line with what we know is going to happen so that it can make your recovery process mentally and emotionally, like I just touched on, as easy as possible for you. So this has been Dr. Anderson with North Texas Plastic Surgery, today talking about post-op recovery from surgery after weight loss. If you liked this kind of content, you can like, subscribe, and comment below.